it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question from one of my clients. And the first question from Natasha in last week's episode was, no one ever told me in the ICU about the complications my dad was having. Was there any medical negligence? You can check out last week's question by clicking on the link below this video. And if you are watching this on YouTube, just click on the link below this video. That'll get you to our website where you have access to this blog post, amongst others. So in this week's part 2 episode of Your Questions Answered with my client Richard, I want to answer the next question from Richard as part of my one-on-one consulting and advocacy service. Richard's mother suffered from a fractured bone due to a fall. His mother then ended up in ICU due to a cardiac arrest and had a tracheostomy during her stay in ICU. So this week's question is, the ICU team is not following the policy regarding the treatment protocols for my mother. How can I respond to this? You can also check out previous one-on-one consulting and advocacy sessions with Richard and myself if you're clicking on the link below this video. So the following conversation are excerpts from email consulting sessions with Richard and myself. So I wrote to Richard, "Hi Richard, here's a quick summary of what we discussed in our last one-on-one consulting and advocacy session. Number 1, you need to focus on your mindset. Some games in life you don't play in order to win, and that's even more important when you're dealing with intensive care teams. Next, it is none of your business what other people think about you, so therefore don't worry about what the intensive care team might think. You are here to advocate for your mom. That's all that matters. Don't overcomplicate and don't overcommunicate either. Keep it simple. Be repetitive in what you want. Keep communication short and precise. Work with deadlines when you're asking for something. This is about your mother and nobody else. Also, quality of life is a subjective and not an objective measure. Therefore, it is important what you and your family want and what's acceptable for you and your family as a quality of life for your mom. And therefore, you can't take no for an answer. Next, let's look at the clinical issues. So all vital signs have been stable on the monitor from the images that you sent. CO2, also known as carbon dioxide, is elevated, but I would want to see the CO2 in arterial blood gas to verify the numbers on the screen, because often the CO2 measured on the monitor doesn't necessarily correlate with the CO2 in the blood gas. Next, your mother is breathing in pressure support CPAP, which is a spontaneous ventilation mode. Therefore, she's breathing with minimal support. The next question also is, why is your mother drowsy? For example, high CO2 or carbon dioxide can make people drowsy, but is it because they're giving her too much sedation? High CO2 sometimes can also be caused from too much sedation, especially opiates like fentanyl or morphine can cause high CO2, because the main side effect of morphine or fentanyl or opiates in general is respiratory depression, and that inhibits the respiratory drive, and therefore CO2 keeps going up. Now the next question you need to ask is, has there been anything else happening clinically in the last few days that they haven't shared with you? Keep asking, and therefore ask for the medical records. Also, if they keep persisting with end-of-life talk, number 1, ask for their hospital policy about end-of-life to find out if they're acting according to their policy. Chances are they're not. Next, keep repeating what you want and ask them to stop talking about end of life in front of your mother, because that's really inappropriate. Also, why is there no cardiologist and no respiratory physician involved? Again, remember, your mum had a cardiac arrest. There needs to be a cardiologist involved and also a respiratory physician with the COPD. Also, the goal needs to be for your mother to get back to mobilization, getting her out of bed, and do not enter into any talk about DNR or NFR or withdrawal of treatment. Just avoid and ignore, and just keep saying that you want your mother to live. You are your mother's voice, and you just keep advocating for her wishes. Next, general knowledge you need to have about intensive care or ICU. ICU has a shortage of beds all over the world. Therefore, they often want to withdraw treatment to free up much needed and in-demand beds. Keep in mind the cost is enormous. One day in intensive care costs about 3,000 to 4,000 euro per bed day. Because you're in Ireland, it's all in euro. Your mother's stay is potentially too expensive for the healthcare system, and that's why they keep pushing for end of life. That's unfortunately the cheapest option. Keep reminding them of those things and address the elephant in the room. Tomorrow I can also talk to the consultant and the nurse if you want me to. For now, keep it simple and take the pressure off you. Nobody can force you to make any decisions. There are no laws around it. You can handle it. I know you can. You'd be surprised what will happen when you put the pressure back on to them. Wishing you and your family all the best for now, Richard. We'll talk tomorrow. So, then Richard writes back. Dear Patrick, I have sent you some images from Mum's bedside from today, including morphine dose at 3 and I think insulin at dose 2. Insulin stopped later in the day. New medication was added later in the day, and morphine went up to 4. Morphine only started today, I think this morning. Here is my response. Hi Richard, the morphine really concerns me. Why is your mother getting morphine? Morphine is only going to make her more drowsy and potentially, quote unquote, prepare for end of life. Unless your mother has been in serious pain and discomfort, there is no reason to give morphine. Morphine will sedate her and make her drowsy. One of the major side effects of morphine is respiratory depression. Whilst your mum is still breathing spontaneously, her CO2 is around 65 millimeter per mercury and normal is 35 to 45 millimeter per mercury. And the morphine is not going to help to bring it down. I understand your mum has COPD and therefore her baseline CO2 would be higher than normal and would be higher than for anybody else. But 65 millimeter per mercury is still way too high. If she's getting more and more drowsy because of the morphine, CO2 will increase and they would need to change ventilation settings to get it down. A high CO2 will also make her even more drowsy. Morphine is one of those drugs when patients are being euthanized, unless they have a clear explanation as to why they're giving the morphine. They should be stopping it, so your mum can wake up and participate in any decision making going forward. Vital signs have been stable besides the carbon dioxide, but the blood pressure is still a bit low, and again that could be a side effect from too much morphine. So wishing you and your family all the best for now, Richard. So Richard writes back, Hi Patrick, I have emailed you 2 attachments, one from me and one from Heather. A draft done quickly, rough and ready, covers many of my main points. I've written it late last night, so excuse it's a bit direct and blunt what I said in the meeting with the doctors, etc. I was polite, spoke less, didn't agree to anything, but did my best to push for information and seek clarity and patient-centered care. explained what I was concerned about, communication issues, etc. I have tried to be as accurate as possible, but written from memory and medical details might be slightly approximate, with strive to understand what has been said and work it out as a lay person. I hope it helps. We'll fill in the details with you later if needed. Feel free to ask details, clarity, etc. Thank you from Richard. And also here are some meeting notes from Heather. Old notes of my mum's file, previous blood clot in lungs, cardiac failure and heart failure, COPD, but no follow-up from a respiratory physician or from a cardiologist. At the moment, she's passing little urine. She's very weak. She was in pain because she had very stiff joints. The arterial blood gases have been deteriorating in the last couple of days. Infection in the lungs and pneumonia is there again. And also the lungs are getting fluids in but not coming out on the other end, causing swelling to legs and arms. They're saying that the vessels leaking and the valves, and the signs are there that my mum won't be surviving. All of above only started since they started talking to us behind our backs. Palliative care was called in no end-of-life palliative care policy yet, except on medications for it. They know there are national guidelines, but only at a committee stage in a hospital. Dr. Smolensk, the intensive care consultant, says there is no withdrawal of ventilator. There should be no change in her medical care. Palliative care just added on sedation and pain-killing morphine. They had given her the full notes to palliative care, but not to us. We mentioned regarding lung specialists, cardiologists and urologists, but apparently they're not available in this hospital. The attitude was that ICU had general consultants and they are good enough. The notes are not complete because we had to hasten to send it out really, but it covers much of the meeting. So here are more of my meeting notes. Attendance was Dr. Smolensk, the senior intensivist. There was a senior anaesthetist, palliative care doctor, patient nurse, ward manager, Heather, Margaret, and myself, Richard. Initial intro by Dr. Smolensk. Mum arrived with respiratory issues, then ended up with cardiac arrest, heart failure, kidney issues, and lung condition. Didn't specify the COPD, but fibrous, I think. I mentioned COPD and queried this regarding diagnosis and treatment of COPD, etc. No real information was given in response to my questions, except it was in my mother's file and that the infection had further reduced her lung function. The nurses' feedback was that they felt Mum had significantly weakened and they were very worried about her. The palliative care consultant's feedback was regarding my mum's swollen arms and legs and stiffness around arms and the general discomfort she was suffering from. Key new information regarding urine output much reduced today, suggesting includes liquids intake but not coming out via kidneys as urine. The vessels are breaking on down, causing swelling in arms, legs, a bad sign. They said they were unable to treat it with medications to get the balance right from the whole organ system. I also asked about the drowsiness and the cause. I had no clear response to this, just said she was much weaker. I asked if any medication had changed. Again, no clear answer to this. I then asked about CO2 output, etc. They seemed to say this was pretty good at the moment. Also, I think from memory, they seemed to indicate the blood pressure had been okay, but not sure now. Referred to blood gas decline, but again, they haven't given me any details. Maybe later from the images today, it will show more. I will check also with Heather in the morning. I did ask for end-of-life policy guidelines. Palliative care then gave a rather evasive and vague answer along the lines that they were working on this in sections and what exactly which part I was needing to see. I think they don't have these guidelines apart from maybe core medicine parts. And they're gradually compiling this from what I understand. I did express surprise and concern they didn't have these available for anyone in ICU or hospital. Heather may be able to explain this better in her notes. From Heather, national end-of-life policy, but hospital only at committee stage and have only agreed, implemented the medication section. Mum, patient notes are to be provided by 3 p.m. tomorrow. The ward nurse said that she didn't have authority to provide these and would need to refer to others. I think the records office possibly. I asked her to follow this up for me. I wasn't convinced she will do this, but I did politely ask for this very clearly and firmly that I wanted to have these. I will do my best to follow this up, submit main form to records office and ask again. I made it very clear that I was most unhappy that important discussions about Mum's wishes regarding will to live had taken place with no family support or consultation over about last 3 days. I felt that it wasn't helpful at all. How could you make patient feel pressured, lack of support, scope for misunderstanding of wishes, etc.? So from my perspective, it's not patient-centered at all in terms of support and not good practice. I noted her inability to speak, and I made it very clear that I didn't want this to happen again and sought their agreement on this. It was very hard to be sure they were agreeing, but no one refused or objected either. I felt very disappointed that no one seemed to be troubled at all, but this was my perception. So perhaps some were noting and will respect feedback and wishes. I brought up the topic of speech support and use of speaking valve, and that I understood that it could be used before ventilation was ceased. So their comment about not to consider this until later ventilation support ended some inconsistency, and it wasn't clear or helpful at all, especially in light of key discussions with her over the last few days. So we discussed the meeting, and more discussions are about to come tomorrow, include our nurse consultant to assist us who has an ICU background. They agreed Dr. Smolens to be involved if possible for this, his day off but around, and he said he would make himself available. In addition to all of this, early in the meeting, Heather did bring up the topic of lack of any specialist diagnosis for Mum regarding lungs, heart, kidneys, etc. And they confirmed that apparently specialists like cardiologists, nephrologists, and respiratory physicians are not available at the hospital level. They said they were okay and doing fine for patients with provision, including general consultants. That was the approximate version of explanations and justifications. Margaret was very upset near the end of the meeting regarding my mum and her sister. She has a great connection with Mum and believing she's so ill and it's impossible that it could be that way. From Richard. So here is my response to this rather concerning email Richard sent. Hi Richard, thank you for your reports and detailed explanations. The arterial blood gases deteriorated could be a sign of infection. We can discuss that later over the phone. I've seen your latest images. They have now changed the ventilation settings and she's not breathing spontaneously any longer. The machine is doing most of the work. Probably a side effect of the morphine again. CO2 remains too high still. They could bring it down by increasing her breaths per minute or by increasing the pressure support and also by potentially ceasing the morphine. It looks like she's on 4 milligrams an hour of morphine, but the image with the infusion is not quite clear. The infusion with 2 mils an hour was insulin yesterday. Unless they have ceased it, it might still be insulin, but I think you mentioned that they may have ceased it. Doctors are talking rubbish if he says ventilation shouldn't be withdrawn whilst he's increasing morphine. The morphine will eventually kill your mother if they don't stop it, especially if kidneys are starting to fail. They are basically trying to euthanize your mum by telling you that they continue medical treatment but put her to sleep on the other end with morphine. We will talk about this in more detail when we get on the phone. I will be busy but ready and available when you need me. Also, here are more comments about, your reports from the meeting, and I have some thoughts and questions. If COPD or lung fibrosis is one of the main issues, they must have done a baseline CO2 test on admission to hospital. What was it and how does it compare with her current CO2 levels? Given the CO2 levels on the monitor, again 65 mm per mercury, and with yesterday's ventilation settings, pressure support ventilation and CPAP, I question that CO2 has gone down, especially with the continuing of the morphine infusion. Morphine has respiratory depression as a main side effect, hence why they now put her in a controlled ventilation mode, where she stopped breathing by herself and gets 10 breaths per minute delivered by the machine. Just for the records, the last image you sent, she's now in an SIMV mode, which again is a controlled ventilation mode. In order to get the CO2 down, the respiratory rate would have to be increased and morphine would have to be reduced or ceased altogether. Another feature that could be used to reduce CO2 is to increase pressure support on the ventilator. I couldn't see that either. The fact of the matter is that a high CO2 and the morphine infusion combined would make your mum drowsy and unable to participate in any meaningful decision making. Again, Richard, unless your mother was in severe pain, there should not have been any reason to start morphine besides, quote unquote, preparing for an end-of-life situation and withdraw treatment. You said that the nurses' feedback that they felt mum had significantly weakened and they were very worried about her. Well, if your mum is weakened, why would they give morphine? It's making her even weaker. You also said that the palliative care consultant's feedback was regarding swollen arms and legs and stiffness of arms and general discomfort. The key new information you said was regarding urine output, which was much reduced, and it suggested that liquids intake is not coming out via the kidneys. The vessels are breaking down, causing swelling in arms and legs, which is a really bad sign. They said they are unable to treat with meds to get the balance right for all organ systems. Well, here's my answer to that. If the kidneys are failing and the doctors are saying she's for full treatment, for full resuscitation, has dialysis been considered as an option? It's much easier to get the fluid balance right with dialysis. Now, you also asked about drowsiness and the cause, and you had no clear response to this. They just said she was much weaker. You asked whether there were any medication changes, and you had no clear answer to this. You then asked about CO2 output, etc. They seem to say this was pretty good at the moment. Now, Richard, as far as I can see, the drowsiness, again, is a combination of the high CO2 and the morphine, potentially also an infection. Have they found a source of infection? Then, next, you say that they seem to indicate the blood pressure had been okay, but you weren't sure. You referred to the blood gas decline, but no details were given to you. Maybe later from images today it will show more. Now, Richard, if the blood pressure has gone down, has she been commenced on inotropes and vasopressors like adrenaline or adrenaline? Inotropes and vasopressors are considered life support, and again, if she is for full treatment, they should have started it. Furthermore, with low blood pressure, the kidneys would suffer even more due to no kidney perfusion from low blood pressure, hence the need for inotropes and vasopressors. The blood gas has probably declined for the reasons I mentioned before. Also, her oxygen saturation is only 89% in the screenshot. It should be 92% and above. She's only on 30% of oxygen, and that could be increased with no problem to get oxygen saturation above 92%. Now, you said that you asked for the end-of-life policy guidelines, and they gave you a rather evasive and vague answer along the lines that they were working on this section and they were asking what parts you wanted to see. And you said that they are not ready with the guidelines and that they're gradually compiling this. You did express surprise and concern they didn't have these available for anyone in ICU or in the hospital. And then you said that the national end-of-life policy is there, but hospital is only at the committee stage and have only agreed implemented the medication section. Well, my response to that, Richard, is that you need to keep asking to put the pressure on. Imagine they are withdrawing treatment and there is no policy. That could potentially be murder. So, and you've asked for the medical records by 3 p.m. the next day, and again, you need to keep the pressure on. You have every right to get access to the medical records. You made it very clear that you were most unhappy that important discussions about mum's wishes regarding her will and her wish to live had taken place with no family support or consultation over about the last 3 days. You made it very clear that you didn't want this to happen again, and you sought their agreement on it. Well, keep asking to keep the pressure on and get agreement. Get it in writing. As far as I can see, the morphine and the high CO2 that could have been managed earlier in the week by changing ventilation settings could have made her more awake to participate in any decision making. You also then next brought up the topic of speech support and the use of the speaking valve, that you understood that it could be used before ventilation has been ceased. Now, you discussed the meeting that I was going to be there tomorrow to assist you, and they agreed, and that's absolutely fine. So then you also said that Fiona did bring up the lack of any specialist diagnosis regarding your mum for the lungs, hearts, kidneys, etc., and they confirmed it's not available at the hospital. So first of all, ask them what they mean by a mum, quote unquote, doing fine. Ask them for their mortality rate as well. Survival rates in ICU are 90 to 93% of all patients. Why should your mum be in the 7 to 10% bracket? Lack of specialty input such as cardiologist, respiratory physician and nephrologist could potentially be medical negligence. So I also have some thoughts and comments here for Heather's meeting reports. You said that there was no follow-up for the COPD, and again, especially with chronic COPD, it would have definitely required specialist input from a respiratory physician. Now, Heather is also saying that your mum is passing little urine, and again, why no dialysis? If she is for full medical treatment, this would include dialysis if the kidneys are failing and can't be managed by medication. Now, you're also saying that your mum remains weak. Now, weakness can happen after 4 weeks in ICU. She's allowed to be weak after such a long time in ICU. Then you also mentioned the pain and the stiffness in the joints. In order to manage stiffness, she could potentially get mobilized or at least have regular physiotherapy. You also mentioned that the blood gases have been deteriorating in the last couple of days. So my question is, why did they deteriorate? My first thoughts are that she was in a spontaneous ventilation mode with minimal support. That's fine for somebody who's weaning off the ventilator. It also means your mom was close to coming off the ventilator. What happened in order for the arterial blood gas to deteriorate and for your mother to go back in a controlled ventilation mode? Is she having a pneumonia or a chest infection? Is she still having daily chest x-rays? How often does she need suctioning through the tracheostomy? And where is the infection? Have they started looking for sources? For example, have they tested chest secretions, urine, and blood to screen for any potential infections? Now, also you mentioned that the vessels are leaking. Well, if the vessels are leaking, your mother might have a significant deficit in albumin levels. Have they checked her albumin levels? And if they are low, they should consider replacing albumin to stop the vessels from leaking. Replacing albumin could also increase your mother's blood pressure without the need for inotropes or vasopressors. Now, you're also saying that the intensive care team mentions that the signs of end of life are near. Well, if signs for end are near, how did she get there? Potentially through unmanaged high carbon dioxide and commencement of morphine. Both make patients very drowsy. Ask them to stop the morphine. What we think is end of life care now started only since they talked to my mum behind our backs. Palliative care called in, no end of life care, palliative care policy yet except on medications. They know there are national guidelines, but again, they're only at a committee stage in a hospital. Dr. Smolensk says there is no withdrawal of ventilator. There should be no change in her medical care. Well, from my perspective, there should be escalation of treatment as long as there is no DNR or any other mutually agreed withdrawal of treatment plans. And certainly, withdrawal of treatment plans have not been mutually agreed on. Palliative care just added on sedation and painkilling with morphine. And again, this could be considered euthanasia, potentially even murder. Let me know when you want to get on the phone again. I can be available anytime, and I will be there tomorrow when we talk to Dr. Smolensk. So stay tuned for more episodes with Richard next week. And thanks for watching. So, how can you become the best advocate for your critically ill loved one? How can you make informed decisions, get peace of mind, real power, real control and influence quickly whilst your loved one is critically ill in intensive care? You will get to that all-important feeling of making informed decisions, get peace of mind, control, power and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you will learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you will learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You will get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You will get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also have a look at our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Also, have a look at our membership site, intensivecaresupport.org, for families of critically ill patients in intensive care. You can also call me. Find international phone numbers on the top of the website. Also, have a look at our ebook section where you get more ebooks, videos, and audio recordings, and where you can also get one-on-one consulting and advocacy with me over the phone, via Skype, and via email by clicking on the relevant tabs on the top of the website. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.